It's time for another episode of The Wellness Effect with me, your host, Seth Mulli. This is the show where we explore all wellness-related topics and matters affecting our daily wellness. In this episode of The Wellness Effect, we continue our focus on employers and how they relate to the wellness of their employees. Go to the YouTube channel to catch up on any of the episodes you may have missed and make sure to subscribe. Teddy Mosomothane joins us in the studio to shed more light on the matter. Teddy, thanks again for joining us.
Always a pleasure to connect with you, Seth.
This week we've been discussing about employee wellness and encouraging our viewers to be on a medical aid. But ultimately, employers are the ones that choose medical aids. And some of them are open, some of them are closed. Could you maybe shed more light on what that is?
Absolutely. So the primary difference between the open medical schemes and the closed or otherwise referred to as restricted medical schemes is in relation to accessibility to those medical schemes and the groups that they serve. And let me build on that. Open medical schemes are accessible to anyone. Any individual can join a medical scheme, and they can come off a medical scheme. This is often subject to any underwriting measures that are provided for in the Medical Schemes Act.
Sure.
So you'll often find open medical schemes imposing those kind of underwriting measures. And let me just emphasize the point: any individual can join a medical scheme, and any employer group can also decide to go along with whatever an open medical scheme has to offer. On the other hand, Seth, restricted or closed medical scheme are often associated with employment or in a specific industry.
I see.
And you can pick up a hint from the words in open on one hand and closed or restricted, on the other hand. And I'll let you deal with my biases here, but because I'm a leader of a restricted medical scheme, it is fair for me to highlight that restricted medical schemes are often best placed to tailor their benefits or healthcare solutions for the employer groups or the industry that they're operating in. This is one of the benefits that come with the restricted medical scheme. And the last point, seeing that you are tolerant of my biases here, restricted medical schemes often allow representation of the employers, on the board, and that enables the employer group clients who are party or are in partnership with that restricted medical scheme to influence the healthcare solutions that are created in a manner that makes those solutions a lot more responsive, to the profile of the employees in that kind of an environment. If I can give you quick examples, open medical schemes, the three that come to mind include Discovery Health Medical Scheme. That's an open medical scheme. Bonitas is another open medical scheme, and Momentum Health is another open medical scheme. These are three examples out of a total of about 16 in South Africa. On the other hand, the first and very formidable medical scheme, which is a restricted medical scheme, is Bankmed, of course. That's an example of a closed or restricted medical scheme, which is confined to originally in the banking industry.
Yes.
But very recently, we had our scope expanded to the broader financial services industry. So that's one example. The government employees medical scheme is also a restricted medical scheme, and ProfMed is also another one which is restricted to professionals because you need to comply with certain requirements in before you can join Bankmed. Now these are three examples out of a total of about 55 restricted medical schemes, in the country. So that's the distinction set.
Amazing. And Bankmed claims to offer this 35% better value.
Yes.
Could you elaborate, first of all, on how you calculate this 35% better value, and what is this better value?
Yeah. Now, the better value is with reference to the quality and the extent of benefits that a medical scheme has to offer, in this case Bankmed, in relation to the level of contribution or price point that any member will have to pay to enjoy those kind of benefits. So those are the key features that relate to how you calculate, this better value. Seth, as you can imagine, there would have been actuarial analysis in how this better value was calculated. And, to simplify what actuaries would actually make complicated, I've already made the point about what the key features are. Value in as far as the benefits that you have to enjoy and how much you pay as far as contributions are concerned. So this exercise was carried out for Bankmed way back in 2014, by the way. And we always had a suspicion, before that, based on the feedback that we were picking up from the industry out there, that there is some richness that accompanies the value or the benefits that Bankmed members, enjoy. And we decided to, commission a study.
Amazing.
So that we can come out with some indicators of, the quantification of this value. Amazing. So that we can highlight it to the members and indicate to them, the extent to which we have created better value over years, of our partnership. Now, in 2014, Seth, it was the actuaries who were operating as Towers Watson then,
yes,
who were our actuaries and consultants, who did the workings. And through the combination of richer benefits at lower contributions, they quantified this better value at 32% then.
Okay.
And it's made up of members enjoying richer benefits at lower contributions. And this is in comparison what they would enjoy from an average open medical scheme out there. And it's important to, to sort of deposit those points. And the reason why we were making a comparison against an open medical scheme, this is where the distinction between open and medical scheme that we touched on earlier becomes relevant here, because from where we're sitting as Bankmed, it doesn't make sense to compare ourselves to another restricted medical scheme.
Correct.
Because joining such a restricted medical scheme is restricted, as the word suggests. So we did this with reference to an average open medical scheme, and as I've indicated, in 2014, that better value was quantified at 32%.
Amazing.
Fast forward to 2024.
Yes.
We had this assessment updated, and the better value is now at 38% actually. Wow. But we have been very modest, if you like, in that we have taken the average between the 38% and the 32%. And communicate to our members that you will enjoy better value to the tune of 35%. Again, it's important to emphasize this point of reference. This is with reference to what our members would enjoy with an average open medical scheme out there. But let me make this other point very quickly, because I'm quite excited about this, Seth, as you can imagine. Credibility is quite important in as far as these assertions are concerned. We were assured in 2014 that Towers Watson at the time subjected their methodology on how they have calculated this better value to conversations at the Actuarial Society.
Amazing.
So we sort of walked away with confidence, that this is something that we can highlight to our members out there, and to those we want to persuade to come over and join Bankmed. So there was really no issue about, credibility, because we had done the basics to be very confident about, that assertion. That notwithstanding, at the beginning of 2023, we decided to subject that assertion to review by a different firm of actuaries and consultants, and that is Alexander Forbes.
Yes.
We asked that they do two things.
Sure.
First, they interrogate the methodology that was applied by Towers Watson at the time, who are now operating under NMG Actuaries and Consultants.
Sure.
And secondly, we asked Alexander Forbes to do their own review as well, independently, and perhaps applying a different methodology. Now, I won't bore you and the audience with the details. What was pleasing for us is the outcome that expressed comfort about both the methodology that was applied by NMG Actuaries and Consultants now, and Alexander Forbes carried out what they refer to as a benefit richness comparison analysis, otherwise referred to as a Berico analysis, to do their own review. The outcome was quite pleasing to us, in that it confirmed what we were always confident about, but we were a lot more confident this time around.
Yes.
So much that we went out there in the public domain and really, made it known that this better value is what differentiates Bankmed from other medical schemes. So I'm going to pause now, because you can pick up getting excited about this beautiful differentiator where Bankmed is concerned.
Yeah, what I appreciate is the not resting on your laurels to an extent that you had externals validate previous research done, previous methodologies, previous targets that you had probably set out for yourself. So I appreciate that. What would you say to employers that are considering Bankmed? Or how would you almost convince them that your scheme is the best restricted scheme to be a part of, those that are within your mandate?
Absolutely, absolutely. So one of the things that, and I mean, I'm going to draw from what I said earlier on about what value entails from a medical scheme perspective. It's really about how much benefit you can enjoy and get from as low as possible where contributions are concerned. That's really what value for money entails, and this is not unique, for medical schemes. So that is one of the first things that I would highlight to those I would be trying to persuade to consider Bankmed or stay at Bankmed. That better value is certainly one of our, differentiators. Secondly, the nature of a restricted medical scheme, and again, I'm drawing from what we touched on earlier on, is such that in a restricted medical scheme setup, you are likely to be in a position to influence the healthcare solutions that a restricted medical scheme puts together in a manner that enables you to co-create those solutions more than that is possible in an open medical scheme setup. So that's a second kind of feature that certainly sets us apart. The third one, and there's a lot, but I'm going to stop on this third one. In a restricted medical scheme setup, a medical scheme is likely to be more responsive to the requirements and even complaints of members, who belong to an employer group that is in partnership with Bankmed, in our case. And I said I'm going to stop at the third one, but I have to sneak this fourth one.
Of course.
We also have a wellness benefit that is called, balance. This is really an add-on that is aimed at encouraging our members to lead, healthy lives, and this really reinforces our efforts to make sure that we don't really interfere in the lives of our members when they're en route to hospital.
Yeah.
We want to engage them in the manner that ensures that the quality of the life that they lead is as exceptional as it possibly can be. And this is also against the fact that we position ourselves as a partner in health and wellness.
I really appreciate the aspects that you've mentioned around co-creation.
Yes.
That there's better value when it comes to contribution, and then this element of this balanced wellness approach, which has been the topic of discussion for the last few episodes, as a driver for productivity and wellness of the individual. So thank you for that. Thank you, our viewers, for watching. Click subscribe and the bell so you don't miss out on the Wellness Effect. Till next time. Bankmed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by Bankmed, yours in good health.